Hi, welcome to 2024 Firefighter Safety Stand Down. My name is Luci Labriola-Cuffe. I'm Deputy State Fire Administrator with the Division of Homeland Security and Emergency Services of the Office of Fire Prevention and Control. Today, we're going to be talking about behavioral health in the fire service. What is it? It's emotions and behaviors that affect your overall well-being. Why is it important? We can significantly improve our quality of life. What can we do to enhance it? We need to start paying attention to it. The facts in the fire service: a fire department is 3 times more likely to experience a suicide than a line of duty death in any given year. In a 2015 study in the Journal of Active Disorders, 47% of firefighters have experienced suicide ideation. 19% have made plans of suicide, 15% have attempted suicide, and 16% have engaged in non-suicide self-injury. Per the U.S. Department of Health and Human Services, 30% of first responders face depression, stress, and post-traumatic stress disorder. According to the Firefighters Behavioral Health Alliance, from 2014 to 2020, more firefighters died by suicide than line of duty. And New York State ranks number 5 in the U.S. of number reported suicides. The Firefighter Behavioral Health Alliance tracks suicides by voluntarily reporting, and they estimate that they only have 65% of the reporting numbers, which means those numbers are very low. So stressors in emergency services, just the schedule and the hours, perception of the public, our culture, the current events that we face, such as today with the rioting and the active shooters, hostile actions, just the nature of what we do, the call volume continues to grow, and the critical incidents that we face. And we need to have emotional preparedness for those critical incidents. And what is a critical incident? It's defined as an incident that overwhelms your ability to cope. And first responders experience significantly more critical incidents than the average person. So critical incidents, what are they? They're a line of duty death, a suicide of a coworker, events involving children, events where a victim is known to a rescuer, and where a lot of our fire departments are volunteer. That happens often. Events with personal meaning, and threatening events, which are starting to happen more and more frequently with the hostile action and active shooter. Fatigue, day-to-day impacts of sleep deprivation, impairs decision-making in complex, stressful situation, degrades ability to self-monitor, reduces perspective and understanding, narrows perception, increases fearfulness, irritability, hostility, and bias, and worsens the mood, which is not what we want in our first responder community. And now there's something new that we're hearing more and more about, which is different from post-traumatic stress injury, which is called moral injury. Moral injury is defined as a psychological phenomenon that occurs when an individual's deeply held moral beliefs and values are violated or compromised, resulting in profound emotional and psychological distress. It stems from internal conflict caused by actions, decisions, or witnessing events that conflict with one's moral code. And it's often overlooked, but impactful on mental health, well-being, and the sense of moral integrity. And it's different from post-traumatic stress disorder, which post-traumatic stress disorder is after witnessing a traumatic incident. Moral injury is after witnessing something that you should have or may have said something about and you didn't. And now you're living with that issue, like watching a probationary firefighter get screamed at by a senior firefighter for no reason and having not said anything about it, that sits with you. So those are the types of things with moral injury, or having management not support you, or other things like that. So that is we're seeing more and more with moral injury, different from PTSD. And now, why is this so significant that we need to talk about it? Because there are barriers for first responders asking for help. There's a cultural stigma. People are feared of retribution. They're feared of being labeled unfit for duty. There's also a lack of high quality resources out there, or they've had poor past experiences with counseling or mental health clinicians. There's also a lack of resources that understand our profession. Areas impacted by the stress of our jobs are physical well-being. It can lead to cardiac problems, sleep apnea, gastrointestinal problems, and many others. Cognitive, as I mentioned earlier, it causes us not to sleep well or think well and causes fatigue. Emotional, we may not react well, we may get angry, depressed. Behavioral, we may not act well with our loved ones. And spiritual, it may cause us to question our things that we believe in. So things to try within the first 24 hours of dealing with a critical incident is physical exercise. And I'm not saying going to the gym if you don't normally go to the gym, but just walk a little bit longer, park a little bit further away from the front door of a store. Talk to someone that knows what you're going through, a colleague. Eat or drink right, meaning just have a little bit more water during the day. Try to eat a little healthier for the next 24 to 48 hours. Structure your time. It's better to have places to go and people to see rather than sitting at home by yourself. And figure out personal stress management, what works for you. Play with your dog, listen to music, go out and have fun with friends. Find ways that are going to make you feel better. And then utilize critical incident stress management services if they're available to you. They do help. Try to get sleep and monitor your fatigue levels. Some other positive coping skills are diversions. Distract yourself, keep yourself busy, write, draw, watch TV or a movie, take a vacation, go for a walk. Social interpersonal skills, talk to someone that you trust. Learn how to say no. We often don't know how to say no to our colleagues. Use humor, spend time with family and friends. For cognitive ways, make a gratitude list. This really helps. Understand what you're thankful for. Brainstorm solutions. Get your brain to think more positively than negatively. Lower your expectations. Be flexible. Keep an inspirational quote with you. And some tension relaxers, exercise, play sports, laugh, cry, and use catharsis. Just go outside and scream. All in all, there are a lot of resources now available for first responders to help their mental and behavioral health. I would suggest most fire departments, if you don't know where to look, there are plenty of resources out there. The National Volunteer Fire Council has the Yellow Ribbon Report, which is a good place to start, amongst many other ones. The IAFF has other reports as well. I would look to get peer support and other services ready for your fire department. Again, our behavioral health is so vitally important. Thank you.